Hi, Dr. Gulani. Congratulations, you've had your surgery and you've been given a long list of your post-op instructions on what to do and not to do. Let me simplify it for you. Basically, nothing should get inside your eye, nothing should touch your eye or hurt your eye, all right? And most of the surgeries I do are without any stitches, so I don't want any undue pressure on your eye, so don't lift, bend, things like that, simple stuff. And most important is please rest. Today in particular, since the surgery and before I see you tomorrow, try and rest on your back if you can. I know in some cases it might be slightly uncomfortable, but I would still prefer if you can please lay flat on your back, eyes closed, and maybe keep pillows on your side and sleep as much as you can, all right? The drops that you've been given, there's a protocol on how to use the drops. And the drops basically, in eye care, there are three main drops that we use, and the colors actually mean something. So here's a great party talk for you. Beige colored top always is antibiotic. Pink colored top is always a steroid, and the gray colored top is like an aspirin. So if you look at them, most of you have received these three prescription for these three kinds of drops, and the color coding actually helps you understand what kind of drop it is. For laser-based surgeries like Lasik, LaZrplastique, laser Corneoplastique, the protocol for drops begins with using the steroid, the pink top, 4 times a day in the operated eye or eyes for the first week, to then taper down to 3 times a day in the next week, 2 times a day in the following week, and then one time a day in the next week. So over 4 weeks, you taper from 4 times a day to once a day. Then the non-steroidal drop that you use, the gray top, is once a day in the operated eyes for 2 weeks. Similarly, the antibiotic that you will be using, the beige top, remember, 4 times a day in the operated eyes for 2 weeks. So the gray and the beige top will come to an end at 2 weeks. The steroid tapers over 4 weeks. Don't forget to use your artificial tears, which are available over the counter in between your drops. And like I've always said, please rest. Keep resting through this surgery, keep both eyes closed, and let your vision slowly heal through the process that I've created for you. You also have a prescription for a Lortab tablet, which you will take after surgery, especially you need it mostly for the night of surgery, if at all. And make sure you're eating well. On a full stomach, take that tablet. It'll also help you sleep through the night. All right, so that's very important. Besides your drops, take that tablet, sleep through the night, and I'll see you tomorrow morning. So besides your eye drops that you'll be using, you also have in your packs a plastic shield. So make sure you remove this fresh shield. And the way you use this shield is you put this thinner side towards your nose. That's how you cover your eye. If you can imagine this, you cannot hurt yourself anymore. This is actually to prevent you from hurting your own eye, which I've just operated on when you're lying down and sleeping, because you can do that in your sleep, right? And if you've had both eye surgery done, then we have a special shield that we give for both eyes. Otherwise, you use this with tape and then remove one of the tapes, pull it up, put the drops, goes back in as you're sleeping and resting that night. Then if you're moving around in the house, you also have dark glasses in your bag. Use that, please, and wear them. And if you can see, when you wear them, it protects you not only in the front, the way it's designed, it protects you on the sides too. This also, because it's dark, lets people around the house know that you had something done with your eyes and stay away from you, so they won't come poking around your eyes. Now remember, I don't expect you to walk around your house first of all, but if you do, this is what I want you to wear. So it's very, very important, please, the physical protection and the drops. And I want you to be very careful, because I've done my job working very hard in getting everything I want from your vision. It's your turn.